Is Dr. Kate Tulenko. She joins us from just outside Washington. She is the founder and CEO of Corvus Health. Dr. Tulenko, one of the things we know, there have been studies done on prisoners who face solitary confinement and what it does to their mental health. Medical experts say, that's endless monotony, the lack of human contact. It can lead to a descent, in some cases, into madness. People have panic attacks, depression, a host of other issues. Now, obviously, folks in lockdowns are not prisoners, but folks in Shanghai, cooped up for 2 months, some of them by themselves, facing isolation. It is a cause for concern. Can you talk about some of the challenges?
Sure, there are a number of different challenges. First, there are people who already have mental illness and who aren't able to access their care or access their medicines. And then there are people who had recovered and whose illnesses are triggered again. And then there are people who weren't mentally ill before, but the stress, the anxiety, and the uncertainty triggers new mental illness. Different people have a different genetic predisposition for mental illness, and that's affected by their life experiences or life events. And so the lockdown certainly is a traumatizing life event that will trigger mental illness in quite a number of people.
And can you talk about China's efforts to improve mental health services?
Sure. One thing they're trying to shift is to make sure mental health care, both therapy and drug therapy, is more available in the community. Because right now, most of it is focused on hospitals and major centers. And in fact, a research study done by the University of Peking in 2020 showed that only less than 1% of people diagnosed with mental illness were getting the proper care.
And Kate, you and I know if we bang our head or our leg or just bump our nose or whatever, we're going to go see the doctor. But when it comes to mental health, there's still a stigma in places in the world. Is that an issue in China as well? And how do you get over that?
Absolutely. It's pretty much a stigma everywhere else in the world. And so getting over it, a lot of it will take, leaders or pop stars or, football stars coming out and talking about their mental illness. For example, when Brooke Shields in the U.S. talked about her maternal depression, that really elevated people's awareness in the U.S. So we need prominent people to speak out. We also need a lot of communication, public service ads about the symptoms of various types of mental illness, and also substance abuse and domestic violence or child neglect. And also helping people understand what mental health first aid is. That when you see a person in a mental health crisis, how do you respond to them and how do you get them the care that you need? In many cultures, people in a crisis will be taken to a religious leader, or they might be locked up in their room or hit and smacked so that they will calm down. And that, of course, is not the way to help anyone with a mental illness.
Yeah, well, let's talk about kids, students. In some cases, they've dealt with lockdowns. There's no socialization, same kind of issues. And I imagine that produces anxiety, stress. And then they've got the cow as well. It's kind of a pressure cooker, isn't it?
Yeah, so you have many young people away from their families, away from their communities for the first time. They also might be concerned if their parents are unable to work, that there won't be the money for their school fees. So yes, it's an extremely stressful situation in young adulthood, which is already a very stressful time for people.